Blood pressure has been long misunderstood, leading to many persistent myths. With heart disease being a leading cause of death, it's important to separate fact from fiction when it comes to getting the real story on blood pressure. So in this video, I'll tackle common myth and provide research-backed information on how diet, lifestyle, stress, genetics, and more truly impact blood pressure. So myth 1. Genetics alone determine blood pressure. While genetics do play a role less than 1%, lifestyle factors have a very significant influence. See, research shows that populations eating a whole food, plant-based, and meat-based diet tend to have low rates of high blood pressure, even with a genetic predisposition. Additionally, studies on twins raised apart show that when one twin developed hypertension, the other did not necessarily. So this points out lifestyle and environment rather than just genetics at play. So fact, both lifestyle and genetic influence blood pressure, with diet and lifestyle modification shown to effectively lower levels. Myth 2. Weight and body composition don't impact blood pressure. See, excess body fat, especially around the abdominal, is linked with higher blood pressure. So with every 2.2 pounds of weight gain, systolic blood pressure, which is the highest number, may rise nearly about a point. And research shows a low-carb, high-protein diet combined with strength training help reduce abdominal fat, lowering blood pressure, and building muscle is also beneficial as it helps metabolize glucose, keeping blood sugar stable. So fact, carrying excess fat can actually negatively affect blood pressure, while building muscle lowers it. Myth 3. Older people just have to accept having high blood pressure. See, while blood pressure does tend to rise with age, and this increase is actually significantly influenced by lifestyle. So in cultures eating a traditional whole food diet, rates of hypertension remain low well into old age. Additionally, the meat diet has been shown just as effective for lowering blood pressure in older adults compared to younger people. Maintaining a healthy diet and of course weight is crucial regardless of age. So fact, healthy lifestyle changes effectively lower blood pressure at any age. Myth number 4. Moderate alcohol consumption does not affect blood pressure. See, even moderate alcohol consumption is actually linked with an increased risk of hypertension. Research shows blood pressure declining across all age groups as alcohol intake decreases. So this effect was consistent whether consuming wine, beer, or spirits. So for individuals with high blood pressure, avoiding alcohol remains prudent. Fact, see, all forms of alcohol at any level of intake can actually negatively impact blood pressure on certain individuals. Myth number 5. Stress is the main driver of high blood pressure. See, while emotional stress may cause temporary blood pressure spikes, studies show effects reverse once the stress ends. Chronic work stress alone does not increase the risk of or for hypertension. However, chronic stress can promote unhealthy habits leading to weight gain in some people. Additionally, see, anxiety may make blood pressure harder to actually control, so learning stress management skills remains beneficial for overall health. So fact, temporary blood pressure rises from acute stress are common and reverse quickly. See, chronic stress itself does not cause high blood pressure long term. Myth number 6. Blood pressure is only concerning if readings are very high. See, the risk of heart attacks, strokes, and kidney failure doubles with every 20 points. Systolic rise above 115, readings above 120/80 qualifies as elevated blood pressure, while higher than 130/80 meets criteria for stage 1 hypertension. And research shows heart disease risk increasing in a linear fashion. So the higher above normal, the greater the risk. And early prevention, of course, and treatment remain main key. Fact, heart health risks rise progressively as blood pressure increases, even before reaching crisis levels. Myth number 7, medications are the first and main treatment. Lifestyle therapies such as diet, exercise, and weight control effectively lower blood pressure in those with mild to moderate hypertension. They also allow partial or total avoidance of medication in select individuals with only slightly elevated levels. Research supports meat and plant-based diets, especially for improving heart health markers like blood pressure. Lifestyle should be the first line treatment. Fact, non-drug approaches like diet and exercise should be initially encouraged, potentially reducing or eliminating the need for medication. Myth number 8, blood pressure issues are only a man's disease. See, due to hormonal shifts women experience through menstruation, pregnancy, and menopause, blood pressure control can be uniquely challenging. Oral contraceptives and hormone replacement therapy also influence hypertension risk. However, women fare worse than men when having a stroke or heart attack, in part due to under recognition of their cardiovascular risks. Diagnosis and management of high blood pressure in women does require a gender-specific approach. Fact, blood pressure concerns are equally important in women, and tailored management is 100% essential. And myth number 9, hypertension symptoms will be noticeable. High blood pressure is often called the silent killer because it can damage blood vessels and organs for years without any symptoms. By recognizing elevated readings early through regular screenings, steps can be taken to actually improve levels before complications occur. Things like headaches, nosebleeds, dizzy spells, and shortness of breath typically only manifest once blood pressure has reached dangerously high levels. Being proactive is vital for detection. Fact, people can have extremely high blood pressure without any symptoms at first, so screening is critical regardless of how you feel. High blood pressure remains an important risk for heart disease. However, many myths exist confusing the facts. Recognizing lifestyle factors like diet quality, physical activity, weight management, and alcohol intake have profound impacts separate from genetics. Additionally, high blood pressure warrants concerns and prompt treatment even before reading reach crisis levels. By debunking common misconceptions, the true evidence-based causes of hypertension come to light. This allows proactive steps to be taken to improve cardiovascular health. Your blood pressure levels and heart deserve that kind of attentive care.